Bismillahirrahmanirrahim. Assalamu alaikum, respected audience. Today, my topic of discussion is about the use of botulinum toxin in the management of infantile esotropia. In 1980, Dr. Alan Scott was the first person to start treatment with botulinum toxin for the management of strabismus cases. Squint cases. Botulinum toxin is derived from Clostridium botulinum and it is an exotoxin. It basically inhibits the release of acetylcholine at the neurosynaptic junctions. When it is given, it takes usually 1 to 3 days to manifest its full action, and its effect remains up till 3 months. Dr. Alan Scott was the first person who pioneered this technique. Before this, the strabismology was mostly dependent on surgical or orthoptic treatments. Today, basically, our focus is about the use of botulinum toxin, which comes with different brand names, and one of that is BOTOX. Its use in essential infantile esotropia. This type of esotropia usually presents with early onset, before 6 months, and angles are very large, largely deviated angles. And if in these patients surgery is done earlier, the chances of developing binocular single vision and stereopsis and depth perception are very high. Even some studies have documented that the chances go up to 73% in such patients. So early surgical intervention was considered very effective and still considered very effective in the treatment of essential infantile esotropia. So this type of squint, essential infantile esotropia, can present with associated features which may be refractive errors, hypermetropia, dissociated vertical deviations, DVDs, inferior oblique overactions, nystagmus, and all these things, if not treated earlier in time, can contribute to the amblyopia. So there is a concept of critical age in the management of such patients. It is believed that the younger the treatment is started, the better are the results. It is believed that when the injection is given into the medial rectus, the muscle which is pulling the eye inwards, it gets paralyzed temporarily, while the lateral rectus muscle starts functioning and pulling the eye outwards. The second thing is, as this is the immature eye, all the systems are developing in the body, so the sensory motor system also works in such a way that it leads to the binocular alignment. So the prognosis, as much as the studies have been conducted, depends upon the initial angle of deviation. If the initial angle of deviation is less than 30 degrees, is less than 30 prism diopters, the results of BOTOX and surgery are almost equal. But if the initial angle of deviation is more than 30 prism diopters, surgery has an edge. If we talk about the complications, there can be many, but usually these patients can present with ptosis. Because we are injecting the medicine in the muscle, and that medicine can involve other areas over there. So this thing can be dealt by advising the patients, if possible, to keep their head elevated 45 degrees for 2-3 days. And some people also prescribe the patching of the eye. Apart from this, there is also chances of developing consecutive exotropia, because we are giving the medicine on the calculations. If the effect is more, the eye can cross the midline and it can cause consecutive exotropia, and then that persists as long as the medicine is there. That is almost 3 months. If we talk about the dosage, there are certain guidelines. The leading strabismologists have developed these guidelines after years of experience. And horizontal muscles, especially I'm talking about, if the deviation is less than 25 prism diopters, 2.5 international units can be tried. And if it is more than 25 prism diopters, the dosage can be increased to 2.5 to 5 international units. The advantages, if you talk about this, is of course short duration. You don't have to intubate the patient. Just medicines are given, mask anesthesia, and an injection is given to the. And then other differences as compared to the surgery. Surgery is relatively expensive, but these injections are cost effective. So there are different pros and cons. So it depends how many doses can be given. Usually people have gone up to 3 doses, but if you talk about essential infantile esotropia, some studies have done that good results can be gained up to 1.5, 1.4. But people have tried up to 3 times. And how much dose? As I earlier mentioned the dose, if we believe that we keep on increasing the dose and we will have good results, it's not like that. Botulinum toxin has an inverse relationship with efficacy. After a certain dose, its effect is no more that much. It is simple calculation that if in a medicine there are 500 molecules and the occupying places, as I discussed, it acts at the presynaptic junctions and blocks the release of acetylcholine. And if, for example, there are 500 places, it blocks. After this, you keep on giving the doses, whatever the dose, you are not going to get the result. So that leads many people to believe that up till 6.5, it shows some results. But after that, its efficacy starts decreasing. Maybe no more that much effect. Technique is very important. It is given under electromyography. It is also given transconjunctivally and even under direct visualization. But the results of giving this medicine injection under EMG and direct visualizations are seeing good results. But if given through the transconjunctival, the results are not that much effective. So the reason I wanted to discuss this topic today with my respected audience is that there is a great debate going on that surgery should be done, injections should be done, what should be the management in these patients. Surgery is the gold standard since years, but at the same time, botulinum toxin has its role, and many physicians claim that during the early time period that the muscles are so much fragile and small that doing surgery on these muscles, of course, it is being done, is perhaps not that much effective as with the repeated injections. So this is one school of thought. But the consensus is still towards the surgical, as I mentioned, especially if the angles are larger. I want to thank my respected audience for their attention and their attendance. Thank you. I will also recommend my respected audience to please go through this article, a review article that is about the use of botulinum toxin in essential infantile esotropia, a meta-analysis systematic review that was published in Investigative Ophthalmology Journal of Visual Sciences. That is very interesting and beneficial, and most of the research literature review I have done from this review article. So I will recommend you to please go through this article also. Thank you.